Hey everyone, thanks for joining us this Tuesday for our Facebook Live. I'm Regan Innes and this is
Karen Wilson.
And
hey guys.
We're going to talk a little bit about ASTYM today. This is a treatment that we have at almost all of our clinics now, and it is an incredibly useful treatment for multiple reasons, and we'll tell you why. But we're going to start off by our Trivia Tuesday question, and we will notify our winner of 2 weeks ago via Facebook Messenger. So if you put a comment below for your trivia question, be sure to let us know this time what the answer to this question is.
Are you ready?
Yep.
Let's
hear it.
Okay, is ASTYM treatment an acronym, an abbreviation, or neither?
That's a tough one.
It's a tough one.
It is a tough one. All right, one more time.
Sure. Is ASTYM treatment an acronym, an abbreviation, or neither?
Okay. Awesome. So
You
put
ready?
the answer below in the comments, and we will announce the winner next week on Tuesday. So first off, Karen, let's talk about what ASTYM is.
Sure. ASTYM is a treatment that we use in physical therapy and occupational therapy a lot.
Mm-hmm.
We use it to help treat soft tissues, and by soft tissues I mean muscles, ligaments, and tendons.
Mm-hmm.
So we're treating soft tissues that have any sort of dysfunction or problems to them.
Yeah. So what are maybe some common ailments that people come in with that ASTYM can treat?
Sure. So lots of different things. We see tennis elbow, which is lateral epicondylitis. We see golfer's elbow. We can see patellar tendonitis or tendinosis. Generally, with ASTYM, what we're treating is a tendonitis, which is an inflammation of a tendon, but generally it's a chronic inflammation of a tendon. So once it's past that acute phase, we don't call it an itis anymore. We call it a tendinosis. What that means is that's a degeneration of a tendon. So the degeneration happens when you overwork, maybe your posture's not good, you're in a repetitive job where you're lifting and or moving things repetitively, and your tissues just don't adapt as well as they need to in those situations. So
Sure. Absolutely. Is this something that would be helpful for athletes?
Absolutely. It is very helpful for athletes. So in terms of what we do for athletes is we will do a regular physical therapy or occupational therapy assessment and then assess what is going on with the patient and figure out if it's the soft tissue, if we think it's soft tissue or a tendonitis or a tendinosis like we talked about. We will implement ASTYM in our treatment. And it is very, very beneficial. A lot of people think it's initially not going to be fun or not very, not. Sometimes people think it's painful, but
Scary.
Yeah, scary because sometimes you can bruise, and that is common, but it is nothing to be worried about.
Yeah, absolutely. We're getting word that it might be a little bit blurry. Is it getting any better?
I think we need to disconnect from Wi-Fi.
Wi-Fi? Okay. Give me 1 second.
Sorry, guys.
Yeah, technical difficulties.
So if we're still live, I
Yeah,
will
we
keep
are.
talking.
You keep talking.
Okay. So in terms of ASTYM, what we do is we use instruments or tools. This is one of them. And here's another set of tools that we can use. 5 different tools that we can use, but these are the most commonly used ones. You can see that I have cocoa butter on this one. Cocoa butter is your friend when it comes to ASTYM. We put that on someone's skin, and then we use our instruments and basically rub over the skin. So I'm gonna show you what we do with ASTYM.
Yeah.
So with Regan, I'm just gonna put the cocoa butter on her arm,
Very well moisturized.
and you'll never, if you have had ASTYM and you have used cocoa butter, or if your therapist has used cocoa butter, you will never smell ASTYM the same. So every time you think of ASTYM, you're going to think of cocoa butter, and every time you think of cocoa butter, you're going to associate it with ASTYM. But if it helped you get better, then that's a good
Definitely.
association. So then Regan just relaxes, and I want you to go ahead and sit back in that chair with good posture. Just sit
Good
up straight.
posture,
There
not
we go.
cross legs. Yes.
Not cross
See
legs.
video 1.
That's right. So exactly. Yeah, we did talk about that. So what I'm going to do is just use this right up her skin. You can see that her skin is getting red. That is normal. I'm going to go through from basically her hand all the way up to her shoulder. If I'm treating her elbow, I'm going to go below the joint as well as above the joint. Because when you have dysfunction or a tissue texture that is not normal in one area, it's likely going to be not normal in other areas too. So we just treat the whole extremity with that. You didn't know that, did you, Rachel?
I didn't. I'm learning something new every day.
So we start with the big one and then we go to the smaller one. It's just nice, easy strokes, and you can see that she is getting red. Is it painful to you?
Actually, it's kind of relaxing. And I'm not gonna lie, I heard it was a little bit painful.
Right.
But it's not, I mean, it's probably not any worse than if you're having pain in a tendon or an area.
Right. And what I'm feeling for, and she can attest to this, when I get to certain areas like right through here, I can feel the tissue texture, so I can feel that it's thick, or it feels like there are bumps in the tissue. And she had already told me previously that she had some carpal tunnel-like symptoms, so some symptoms of numbness and tingling in the hand at times. I immediately asked her, being the therapist that I am, if she had her neck checked out, just to make sure it was not anything else.
Right.
So, again, that was the second instrument, and then I'm going to go to the small one, and then I'm going to basically isolate that tendon. So I'm going to go right on that common extensor tendon here. You doing okay?
Yeah, I'm doing great.
We have some people joining us. Courtney and Whitney and Tiffany. Hi, guys.
The whole gang.
That's right.
I love it. I mean, this really isn't, it feels warm.
Right.
Obviously, because the blood is flowing to the area, and that's where the redness comes in, but it's not uncomfortable.
So then I be nice and make nice with her.
Because this is where it
Because
gets
this
bad.
is where it gets, no.
Uh-huh.
So we're done with that side. So what I would do then is have her flip her arm over, and then I'm going to get cocoa butter on the other side.
Now I feel like I'm going to be ill moisturized
I
on
know.
this side of my body.
We can work that out. Same thing. We'll just go up. Usually the inside of the arm is a little bit more tender than the outside. And I think the reason for that, if you are going to bump your arm or bump your leg, you're usually not going to bump it on the inside. So it's generally a little bit more sensitive.
Yeah.
Is that a little more sensitive in there?
It is, and it's mostly like near the elbow
Yes.
that's a little bit more sensitive.
And your ulnar nerve runs right through there too,
You know.
so that's pretty important.
Yeah. How long does a treatment usually take?
15 minutes.
Oh,
It doesn't take very long. We usually do between 8 to 10 treatments. That's normal. If it's a more chronic condition, then we will see someone longer. So if you've had this issue for a long time, then we may need to see you longer. But you usually know within 3 to 4 treatments if it's going to work.
Gotcha.
So
Is it
you should
something-
notice a difference.
Yeah. Is it something that's included in your like normal PT session, or
It
is it
is.
something you have to schedule outside?
No, it's included in the normal PT session. So we would do an assessment just like we do with everything else, and we would determine if we do think it's soft tissue. If we think it's soft tissue, which that goes back to the muscle, tendon, or ligament, then we will try ASTYM on you and see if that will help. And, basically we're helping to regenerate that soft tissue. And by doing that, we're stimulating her body's normal healing process. So your body goes through 3 phases of healing normally if you get injured, or you're, like I said before, if you have had a repetitive injury or you've had surgery. Now, when a tendinitis, like we talked about before, when it becomes that degenerative tendon or a tendinosis, what happens is your body stops in those 3 phases of healing. Your body stops healing, and you have got to jumpstart that. And one good way to jumpstart that is by doing ASTYM. It's a really good treatment to help jumpstart that inflammatory process, because even though we think of inflammation as being harmful, it really isn't. Your body has to go through that inflammatory phase in order for you to heal. So the reason, if you can see on Regan, that I have gone in line, if you think about muscles and tendons and ligaments, they're all in parallel. So they're all in line here. And they should be. That's how they were designed to be able to, the muscles especially, to be able to develop the tensile strength that they need in order to basically function the best. And if we don't have that, you're not going to be able to have the strength that you need and not be able to function the way that you need to.
Right.
So
when that scar tissue happens, it can kind of throw off that parallel.
It does.
Yeah.
It does. So when collagen, new collagen is laid down, scar tissue, what happens is it just lays down haphazardly. So it doesn't lay down in that parallel pattern. And when it's not parallel, when it's haphazard, your body doesn't always respond as well as it needs to.
Right.
So I'm going to go on to her.
The pain.
Right. And a lot of times that is what causes the pain. So we still assess the joints, and we still assess other everything else in the body to make sure that everything else is functioning properly. But if we do think it is a soft tissue issue or injury, then we're going to try ASTYM.
Huh.
So now I'm going to do her hand. This is my favorite part.
Why is that?
When I'm the patient, because it feels awesome.
It does feel really good.
It feels awesome. Technically, I would stand up, but I'm going to just, for purposes of the video, sit. Yeah.
It does make a little bit of a sound, but it's not like alarming. I mean,
yeah, you can, especially when you're going over the tendons in the hand, and you can hear it.
Yeah.
Kind of crunchy.
It is kind of crunchy.
I bet your other side wouldn't be this crunchy.
So for someone who hasn't or doesn't have, maybe someone who you might think needs this, but then you do the first treatment and maybe you don't feel those bumps or ridges, is that something that you take into consideration before you perform the next?
Absolutely. So if we don't feel any bumps or ridges or any difference in tissue texture from one arm to the other, or from one area to the other, then we may not continue it. But if a patient comes back, so say I didn't feel a lot of increased soft tissue texture, but you came back and said you felt a lot better, I would probably continue it, because your body probably needed to have that healing phase basically jump-started. So
yeah, absolutely. How long have you been performing ASTYM?
For about 10 years. For a while. They've changed it. So when I went to the course, we were pretty rough, so to speak. I mean, it was a lot harder. The pressure was a lot harder. It's not near that today.
Right.
I mean, it's a lot lighter.
Right. Well, it just feels fluid.
Yes.
Yeah. So.
And that's how it should be.
Yeah.
Versus me raking over your skin.
Yeah, that would not feel good. We just wanted to say hi to some of those of you who are joining us. We are talking a little bit about ASTYM. If you have any immediate questions, drop them in the comments below. We do have one that says, is there a difference between ASTYM and iASTYM?
Yes, so iASTYM is instrument-assisted soft tissue mobilization. ASTYM is, I'm not going to give you the answer to the question, but ASTYM describes a mechanism by which your body, the treatment, causes your body to go through a stimulation in order to stimulate that healing process. So ASTYM is heavily researched. The difference between iASTYM and ASTYM is that ASTYM is heavily researched. I don't know that much about iASTYM myself. I don't do it. But ASTYM has put a lot of money and time into research for ASTYM. So both of them are soft tissue treatments, but ASTYM has a lot of research backing it. And the difference, one of the main differences between them is that the tools, we will always use the same tools with ASTYM, and we always do everything in a very patterned movement. So I will always go up your arm twice and down your arm twice. I will go to each specific area. And iASTYM, to my knowledge at least, does not have that specific pattern to it. And that's what I know about it. So
sure. And just to recap, this is a treatment that can help many different ailments. So if you want to re-go over those a little bit.
Sure. So with Regan, I was treating her for carpal tunnel and possibly some tennis elbow or lateral epicondylitis. You can use it on the inside of the elbow. You can use it for shoulder bursitis, for a frozen shoulder. You can do it on the neck. You would never go on the front of the neck, but you can do it on the neck muscles in the back of the neck or the back itself. You can also do it on the hip for hip bursitis or trochanteric bursitis or IT band syndrome, patellar tendonitis, and any really foot or ankle injury, an ankle sprain. You wouldn't want to do it on a hot, warm ankle, but a couple weeks in, you could do it on an ankle just to get, once your body has kind of gone through some of the healing, just to jumpstart that.
Definitely.
It wouldn't feel very good on a very hot, warm, sprained ankle.
Right.
Also, you can do it on patients who have had a bunionectomy or any toe deformities or toe issues. And it really helps for the foot. We would start at the big toe and we'd go all the way up to the hip. And again, the reason we do the whole extremity is because when you have dysfunction in one area, you generally have dysfunction in other areas. So some patients wonder, why are you going all the way up to my hip when it's my foot?
Right.
But we do generally assess, and if we find that there's not increased soft tissue texture up further, we don't have to continue to treat that, but I think it is good to treat the whole extremity. Patients really benefit from that.
Are there any patients who would not necessarily, this wouldn't be a great treatment for them?
Sure. So some contraindications would be if you're on a blood thinner. Patients normally do, a lot of patients bruise, not everybody, quite a few patients bruise. Sorry, that was me moving the table. A lot of patients do bruise, but if you're on a blood thinner, we generally don't do it, or we use that as a relative contraindication. We would clear that with the physician,
Right.
too. So
Right.
that's one of the main things. We don't ever do it on a patient that has any sort of infection, because that can spread, like a skin infection or anything like that. We wouldn't do it over that, or even a body infection that can make you feel really worse if we do it. If you have a really bad sinus infection or any other infection, we would use caution when we did it, because it could definitely make that worse, because we're basically stimulating your body to be inflamed, at least in that extremity. So a lot of times too, if we have people that we do it on both sides, I use caution myself when I do both sides of the body, because afterwards you can really kind of feel like you're sick, or not feeling very good. So that's where the water comes into play. We really encourage patients to drink 60 to 80 ounces of water a day when we're doing ASTYM. We're also going to give you a stretching program and a strengthening program to make sure that what we're doing is stimulating your body to go through the normal phases of healing here, but you have to stretch and you have to strengthen on the days off, in order for your body to heal properly and for those fibers to line up nice and parallel like they're supposed to.
So it's a multi-level process that
Absolutely.
doesn't just end after your therapy
No,
session.
no, it does not end. So you'll have a home exercise program, and then we also encourage you to be active when we're doing ASTYM. So sometimes we want people to lay off of what they're doing, but when we do ASTYM, generally we'll tell you to keep doing your normal activities, which is nice. Patients really like that, and athletes really like that.
Yes.
Especially if you have a pulled muscle or an irritation to a tendon itself.
Right.
So
Awesome. Well, I think that's all the questions we have. Let's go over our trivia question one more time. So in the comments below, place your answer to this question.
here's the question. Is ASTYM treatment an acronym, an abbreviation, or neither?
Okay. Awesome. Well, thank you guys for joining us. If you are watching the replay, feel free to drop your questions in the comments below, and we will get back to you sometime tomorrow. So thank you so much.
See you next week.
Bye.
Bye-bye.